Hello. Hello, everybody. It's Friday, May the 25th, 2018, and um, I get, I'm doing this video to see if anyone has any information on this situation that I've just been, just found out about. I've been having pancreatitis a lot lately. I've had it 5 times in the past 2 years, been hospitalized 5 times in the past 2 years. I don't drink, smoke, or do drugs, but I eat, and I have high triglycerides. And that's why I have the pancreatitis, because my triglycerides are in the thousands. And I know that sounds crazy, but it's true. And even though I don't drink, smoke, or do drugs, isn't that weird? And I don't even eat pork, so it's weird. But anyway, whatever. I have it. I see the lab reports every 6 months. But anyway, um, so I was gonna have a colonoscopy and an endoscopy done. Um, and the protocol for that is to give the patient propofol to put them out with, and while they do the endoscopy and the colonoscopy. So my daughter, she knows a lot. Both my daughters know a lot about. I won't say what they are, but they know a lot about the things like this, and I was suggested by them to check and make sure with some professionals if I can be put out due to triglycerides that high. So my gastroenterologist, I asked him at our meeting if that was okay for me to be put out with propofol, since it is a fat-soluble um, drug, which means it binds to fat that's in the bloodstream. And in this case, my fat would be heavy because I have a lot of triglycerides in the thousands. I also asked him if he had ever performed a colonoscopy or endoscopy on someone who has triglycerides the levels that I have, and he said no, but that the propofol would be fine. Assured me everything would be fine. That's a safe drug. Da da da. So upon that, I went ahead and scheduled the colonoscopy and endoscopy. But between then and today, I have talked to several professionals, one of which is my pharmacist, who is a drug specialist. Pharmacists, they know drugs better than anyone, even better than doctors, although doctors should know drugs. But it seems that doctors know a lot of drugs. The only thing doctors know about drugs are what the drug reps tell them. And most drug reps have nothing but an associate's degree in not even a medical field. So know that too. So it's all about props, or not, or I'm using the wrong term, perks and stuff that the doctors may receive from drug reps, whether they prescribe medicines. But that's another story. Anyway, um, so my pharmacist said no. Julie, he said, you need to be released from a health doctor before you should be under with propofol because it's fat soluble, lipid soluble, which I already knew from my daughters. It's a lipid soluble drug, which means it would bind to the fat in my blood, which is high levels of triglycerides, thousands, that is, and I may not wake up. So, I got to thinking that may have been what happened to Michael Jackson. Isn't that funny? He may have had high triglycerides too, because it has nothing to do with whether you're skinny or fat. But anyway, that's another story too, which is a neat, maybe his family should look into that. But anyway, so I did an MRI yesterday because I went ahead and scheduled the colonoscopy and endoscopy before I knew all this, and I have I had an MRI appointment from that same doctor, which was just for it's the MR abdomen MRCP protocol for doing. I read that off my report right here. It's the protocol to do an MRI like that before you have an endoscopy or colonoscopy. So it was for me because I have pancreatitis a lot. So my daughter picked up my lab today, the results from that. The doctor, my gastroenterologist, is on vacation. So she picked up the report, and I'm going to read it to you all. It says, history, epigastric pain, recurrent pancreatitis. Technique, multiplanar MR without contrast using heavily weighted T2 sequences for evaluation of biliary tree. Findings. Biliary tree shows no dilation to indicate obstruction. That's good. No stricture or filling defect is seen to indicate cholelithiasis, which my daughter says meant some kind of stone. That's good because it says none seen. Pancreatic duct is unremarkable in its visualized portion, which is good. Unremarkable means no big deal. It's the same, just an unremarkable thing. Now, no abdominal mass or ascites is seen. That's good too. There's no masses. The gallbladder is unremarkable. Awesome too. I love that because I have a lot of pain over here on the right side at the top, and I was wondering about that. But that's my liver. So there is mild edema within and surrounding the pancreatic tail. Tiny, less than 1 centimeter cyst lesion is seen of the pancreatic tail, probably a pseudocyst. Now, that scared me because a pseudocyst means it's not a cyst, but it acts like a cyst. But that's good because that means it's not a cyst. But if it's a real cyst, it could be a cyst. They said probably a pseudocyst, but it could be a cyst. A cyst, I've looked up online, and they can be malignant. And if you have a pancreatic cyst that's malignant, that would mean that it would spread fast and be cancer. So, because pancreatic cancer is the worst. So that scares me. Mild renal scarring is present, which means that I have a little bit of scarring on my kidney, on one of my kidneys. An upper pole left renal cyst is seen. I have a cyst on my kidney. There is no evidence of extrapancreatic pseudocyst or ascites. Impression. Findings suspicious for mild pancreatitis. And I know I'm having mild pancreatitis these past several days. That's why I haven't posted anything. I have tried to fast as much as possible because that's what they do to you when you go to the hospital for pancreatitis. Heavy pancreatitis, I would be screaming right now and in the hospital. And they just fast. They keep you under fluids and you fast, and that's it in the hospital. So I know I have that mild pancreatitis because if it was regular pancreatitis, which is what I've been hospitalized 5 times in the past 2 years, I would be screaming. So it's definitely mild. I'm trying to keep from going to the hospital by fasting at home and drinking water. So the impression, down here at the bottom where it says the impression, I'm going to cover this up here because that's my information. I don't know if you can see that. The impression, it says, Findings 1. Findings suspicious for mild pancreatitis involving pancreatic tail with a probable intrapancreatic tiny pseudocyst. 2. No evidence of cholelithiasis or biliary obstruction. So, does anybody know anything about this? I don't want to have a biopsy, but everything I've looked at online says that you'll have to have a biopsy to tell whether it's a cyst or a pseudocyst. I really don't want to have a biopsy because I can't be put out. And I called the offices of some places that I know, and they said typically it's done at a university hospital. Why? Do they use students? I don't want students to do things on me, because students usually mess up. I know of several university hospitals that have messed up because they've used students. So I was advised that you can tell them, no, you don't want students to touch you in any way on any kind of procedure that you're doing. But again, when you're in the operating table, when you're on that operating table and you're put out, how would you know if a student was doing anything on you or not? How would you know? You wouldn't know. And I asked the several professionals that I said, and all of them have told me, if something happens, ask for an operative report, and that would show who exactly touched you, did anything to you on the operating table. So then you would know. So that kind of helps me. At least somebody would know. But, that stuff, who really knows? But, yeah, that's another story. My phone's ringing. Hold on. Hello? Yes. Hi. Yes, absolutely. Really? Can you say that again? I'm doing a YouTube video. I have a mukbang channel, and I'm doing a YouTube video asking people if they know anything about it. It's scaring me to death. Can you? I'm gonna put you on speakerphone. Will you say that out loud? Jenna, my daughter's out here too. She wants to hear it because any kind of positivity is good for this stuff. Jenna. Okay. I might have to walk outside. Excuse me. I'll be right back. Not for you, but my. And you've worked in the prison. This is Amanda, the nurse at my gastroenterologist's office. I'm gonna put you on speakerphone. Are you there? Okay. Will you tell us what you just heard? What you just said to me? Your blood, I'm supposed to check the blood, and I knew I talked to you earlier. Your blood work, it looked okay. Your sugar was high, but everything else is really pretty much normal. Like your B12 looks really good. Jealous of your B12. Your B12. Oh, good. Well, I've been taking a B12 shot, but I only had one week, and I need to get back on that. Tell me something, though. I thought you were talking about my MRI. Did you get a hold of that, too? No, they have not sent me a copy. Okay. I went inside the fax machine with no paper, so I fixed that, and they're getting coming off. Okay. Okay. Well, I thought that was what we were talking about, but we'll still say it. We're gonna still say that it's gonna be fun. Yeah. Thank you, Amanda, so much. That's very kind of you. You have a great day. You too. God bless you. Bye-bye. Bye. So that was dramatic. I thought she was going to say something positive about my MRI report. I know my blood looked good, other than my triglycerides. I know that, which they didn't check that because we already know what that was. But she said she was jealous of my B12. Huh. So anyway, back to the situation. I'm still going to claim this going to be okay because the Lord has got me specifically. Yeah. Specifically, Isaiah 40:31 and Isaiah 41:14 says that the Lord will take care of us. He takes care. It's going to take care of me. But anyway, if anybody has any information about this at all, if your loved one or somebody that you know has been through this, even if it turned out bad, please let me know, because that way I can take the steps to not do what they did if it turned out bad, and to do what they did if it turned out good, because I'm really scared. And really hope that somebody has some information. And if it's bad information, that's nothing that's going to cause me. I'm the type of person, if it's true, I just want the truth. If it's bad information that you've known somebody that's had the same stuff going on and it ended up bad, please let me know. That won't cause me to go down on positivity or anything like that. It will help me know what not to do. And I love to prevent things. So please. And if you've had any positive things in someone you know or yourself, please post down below or post down below and spread this around so that somebody can maybe give me some information without me getting so many different informations from doctors. And thank you and have a good day. And hopefully I will be eating soon and can mukbang. And if not, well, I'll see you then. Thanks. Bye.